Hi there. I just wanted to say thank you for sharing a little bit about your nursing experience and a little bit about your stressors. I do understand that finding a healthy balance, in our profession is quite difficult because there's definitely a lot of triggers, and there's just nursing is a profession that I think is so difficult comparatively to other professions that I have looked into and heard about. It really does test not just emotional ability, your emotional capacity, but it also tests your physical abilities. And I just want to say good for you for choosing to transition to a less stressful position. It's funny because I kind of did the opposite. I transitioned to a glorified charge nurse. It's called a patient care coordinator. So with that, I do have a little bit more responsibilities. I'm considered middle management, and I kind of like the high stress environment, but then again, I'm just getting started with my nursing career. I've only been a nurse for 3.5 years, so I'm sure that could change. And going on to the my research part of it, I had a article that I was reading about, especially during COVID-19. We all know as nurses, COVID-19 really kind of broke broke healthcare a little bit. I think it was just such a high stress and high anxiety environment that nurses at that point were kind of at their breaking point, mentally, emotionally. And this study really focused on how there's different kinds of coping. There's problem focused coping, and then there's also emotional focused coping. And I guess problem focused coping is attempting to eliminate a perceived threat. So obviously the threat would be COVID-19. However, we really can't eliminate that. However, we can do things to protect ourselves, like wearing PPE. But it also refers to emotional focused coping, which essentially is to reduce emotional discomfort or negative effects triggered by the situation, which I think is more of your typical kind of coping. You just try to suppress it. However, they found that one or the other really wasn't the answer when it came to coping. You needed a combination of both to be able to for the most I guess mental satisfaction. It was proven that if they used both of these coping mechanisms together, that it improved the mental health of nurses, which I found kind of fascinating, that there was so many different coping techniques. I know everybody copes differently, but I just thought it was a really interesting article. But yeah, so good for you for getting yourself out of a high stress environment. And I like to think that we're all in this together. Us nurses stand by each other. And yeah, thank you for sharing.